So all states across the country have some version of the Medicaid waiver system. And to break that term apart a little bit, Medicaid just means this is a service that is funded and governed by Medicaid, what is usually health insurance for people who are poor, aged, and have disabilities. The waiver piece is moving the state's requirement that anything they offer under Medicaid, they offer to everybody with Medicaid, and it allows the state to carve out special services for predefined populations who have a higher level of need. When you apply for a waiver, you go through the application process. You're found diagnostically eligible, meaning you have a developmental disability. You're found functionally eligible, meaning you have significant needs in some life areas that we know need support. And then we look at putting you on the waiting list based on urgency of need. And we started this whole pan-state urgency of need system in earnest in 2016. So once you apply for the waiver, you're asked a whole lot of questions about the urgency of need really of the whole family, because the state relies on parents in Virginia to provide billions of dollars in free services and supports that their children are eligible to receive through public programs, because their needs are so much greater than the other typically developing children those parents anticipated having in those cases. Those parents talk about their health status, physical and mental health status, their ability to provide supports to their children. People who have significant hardships are put in priority 1 of our waiting list, and the state says those people shouldn't have to wait more than a year for services, which is pretty extraordinary to think about as criteria for people who we know are experiencing some form of crisis already. And that waiting list at the present time, I believe in January, was 2,907 people. And we funded 494 waivers this year. So we funded 1/6 of the people we said are in crisis and shouldn't be waiting any longer. And then beyond that, the other 8,000 plus people on the waiting list are divided between tier 2, where there's some kind of need that we see arising. Maybe parents are aging but doing okay. Maybe this child is seeing a kind of a spike in behaviors or medical needs or other kinds of things, but we're managing it for now. And priority 3, which is mostly parents who have really young children, maybe with pretty mild needs, who are doing very well in the school system at the time, but who know the waiting lists are extraordinarily long and have to start planning now.